This video was created as a tool for healthcare facilities to better understand medical necessity guidelines for ambulance transportation. We will define medical necessity, discuss common misconceptions, provide tips for an efficient process, and review 3 forms: the PCS Quick Guide, the PCS Form, and the EMS Transfer Form. First, let's review the medical necessity to get a better understanding of when the form should be utilized and what conditions will qualify a patient for ambulance transport. You should know that another common name for medical necessity certification is Physician Certification Statement, or PCS. You will hear both terms throughout this presentation. Why does a patient need a medical necessity form? In 1998, the Department of Health and Human Services published a paper that stated 50% of ambulance claims from 1996 were not medically necessary, highlighting widespread misuse of EMS resources. This led to the Center for Medicare and Medicaid Services, or CMS, to create new guidelines for federal insurance companies, which required healthcare providers to document the medical necessity of a patient to travel by ambulance. Most private insurance companies utilize the same federal standard. What does it mean when a patient meets medical necessity criteria? Medical necessity is established when a patient's condition is such that use of any other method of transportation is contraindicated or would endanger the individual's health. When does a patient need a medical necessity form? Any non-emergency transfer, discharge, or appointment will always require a medical necessity form in order to bill insurance. A 911 emergency call and an emergency facility transfer do not require a medical necessity form. How does this process affect the patient, EMS provider, and the facility? An incorrect or incomplete PCS form delays timely billing. It causes the need for EMS to follow up with the facility and request additional documentation or amended forms, which can be very time-consuming for both parties. If the insurance denies the claim due to poor documentation, the patient will be stuck with the bill. Oftentimes in this situation, the EMS provider has difficulty collecting for services rendered. PCS forms are subject to federal audits. Falsifying PCS forms or other documentation can lead to monetary fines or jail time. Not just for the healthcare provider, they can also be imposed on the individual. The PCS Quick Guide chart was created with facilities in mind to help understand what federal regulations require. The chart is sectioned into 4 columns: medical condition, bed confinement, attendant monitoring, and supporting documentation. Medical condition would be the patient's diagnosis or current condition, either physical or mental, which proves their need for an ambulance. Bed confinement is when a patient cannot ambulate, cannot sit in a chair or wheelchair, and they are unable to get up from the bed without assistance. Attendant monitoring is a common reason for ambulance transport due to the patient needing some type of specialized care, supervision, or medication during transport. Supporting documentation provides more detail into the patient's destination selection and reason for transfer. The more supporting documentation that is listed for a patient, the more likely the medical necessity will be approved by the insurance company. 5 common medical necessity misunderstandings. Number 1, because a patient arrived to an ER by ambulance, they need to leave by ambulance. This is incorrect. A patient should leave by the most appropriate means, which may be a taxi, personal vehicle, or a wheelchair van. Number 2, the patient is on oxygen, so they can go by ambulance. If a patient can self-administer their oxygen and have no other medical necessity, they should not use an ambulance. Number 3, the patient is bed confined, so they need an ambulance. Bed confinement alone does not meet criteria for ambulance transport. There must be supporting documentation or medical conditions listed to be compliant with federal guidelines. Number 4, the patient is obese, so they need an ambulance. Obesity alone does not meet medical criteria for ambulance transport. Number 5, the PCS form was filled out, so the EMS provider will be paid for services. If the PCS is incomplete, falsified, or has no supporting documentation, insurance companies may deny the claim. Now that you understand medical necessity, we will review the actual PCS form. This standard form is recommended by the Birmingham Metro Ambulance Alliance It captures all pertinent information and can be submitted to any EMS provider. Using a single form for all EMS providers streamlines the process and minimizes the chance of an incomplete form. An efficient process benefits the healthcare professional that prepares the transfer paperwork. This form has 3 sections. The first section is basic patient demographics, medical information, transfer information, and equipment needed for transport. The second section is the medical necessity questionnaire. In order for the form to be valid, these questions must be answered by the healthcare professional signing the form. The third section is for signature of the physician or authorized healthcare professional. If the form is repetitive, only a physician may sign. Repetitive forms would be appropriate for dialysis, hyperbaric chambers, radiation, and wound care. If the form is for a single or round trip, then a range of healthcare representatives can sign. Here is a list of these authorized personnel. It is very important for PCS forms to be filled out correctly. Here are some additional tips you should keep in mind when you need to arrange for a non-emergency ambulance transport for a patient. Number 1, ask yourself, why can't this patient leave by car, taxi, or wheelchair van? Answer with as much detail as possible so their need for ambulance can be proven. 2, if patient is being transported due to services unavailable at a sending facility, those details must be in the documentation. 3, if a patient is not accepted by the closest hospital or facility, that information should be provided to support extended mileage to the patient's destination. 4, the date of service should match the healthcare provider signature date. 5, the PCS form is only valid for round trips on the signature date. If the PCS form is being submitted for a repetitive patient, the form will expire 60 days from the signature date. 6, patient information should be typed or written on the form. Patient demographic stickers are not acceptable for billing purposes. 7, ensure the healthcare professional signing the form has listed a printed name, assigned name, credentials, and the signature date. If the PCS form does not contain all elements required by CMS regulation, the EMS provider may submit the claim after 21 days if they can prove there was an attempt to obtain corrected information. In order to prove this attempt, an EMS company has to send a certified mail request to the facility. If no documentation is obtained, the claim has to be resubmitted with a certified mail receipt. This costs the EMS provider countless hours of manpower, the price of certified mail, and the potential loss of revenue. Here are some common reasons that insurance companies will deny claims: missing or unreadable information, invalid credentials, incorrect date of service or missing signature date. The last form we will cover is the EMS transfer form. This form's purpose is to fill in the remaining transport details not listed on the PCS. A completed transfer form combined with a completed PCS form, face sheet, and H&P would provide all the details needed for the EMS to accept and schedule a non-emergency transport. The goal is to have the facility fax or email these documents to replace the phone call to EMS communications. When these forms are received, the dispatch center will review the details and call back to confirm, decline, or negotiate pickup details. The EMS transfer form provides instructions at the top, most of which have already been covered in this video. It asks for minimal patient demographics, since those will also be listed on the PCS form and face sheet. It has fields for event settings, isolation precautions, payer, pickup, and drop-off details. Destination information is crucial to a smooth transition of care. You will note we are requesting contact details for family members, as we cannot leave a bedbound patient alone at a residence. We ask if the drop-off residence has stairs, as that may require special equipment or extra personnel. Please note that sending this form with other requested documents is not suggested for emergency or stat situations. Phone calls are more efficient for quick action during those types of requests. When in doubt, consult your primary EMS provider to confirm the appropriate process. As EMS providers, we understand the importance of moving a patient from your facility as quickly as possible. As healthcare professionals, we all have a responsibility to the community to ensure EMS resources are being utilized correctly. Due to many invalid PCS forms or lack of patient information for billing, EMS services are moving towards requesting these forms to be provided prior to dispatching the ambulance. Having the correct paperwork in advance creates a more efficient process. It will allow a medically necessary patient to be transported more timely with less potential for patient or provider billing issues. You should confirm the appropriate process with your local provider. Please understand this process may not apply for preferred EMS provider agreements. Thank you for taking the time to learn more about the medical necessity process. Please share this video with anyone who may need additional training or information. The Birmingham Metro Ambulance Alliance aims to be an excellent partner in our communities and facilities by enhancing the EMS process throughout the great state of Alabama.